Hello, this is Paul Thomas. I'm here to inform you that this edition of Health Talk is a pre-recorded episode. And there it is, the disclaimer, the legal disclaimer. That was pretty impressive, huh?
Well, yeah, it really was. I mean, that voice of yours is just like magic coming over. And here we are making one more recorded show because I just got back from a cruise and found out I have to be in the Midwest in Chicago on Wednesday night. So I'm going to have to leave on Wednesday morning to get there, so I won't be able to do our first live show in a while, and so this is another recording. So hope everybody's doing okay. Had a great time on vacation. I went to Costa Rica and to Key West and Guatemala. I think Nicaragua or Ecuador. Cartagena, Colombia, South America, Central America, and then Acapulco and Cabo San Lucas. So each place I was able to disembark and see how the other part of the world did healthcare. In some countries it was pretty impressive. In other countries it was pretty loosely organized, and they sold everything right out of the pharmacy, whether they were pharmacists or, and in the Mexican areas there was about every other storefront was a pharmacy. Went into one general store that had a pharmacy in it, and that individual was really a pharmacist, and he didn't sell any controlled substances, which is a big thing down there, narcotics, diet pills. The problem is you don't know what you're getting. So, but anyway, we're going to be talking about other things other than my trip, and there's a lot of opportunity to collect new information, and so we may not get through all of it today, but the thing that I really hadn't decided to talk about came across in the New York Times, and actually was in the Press Democrat yesterday morning, and it was about people not taking their medications in the United States kills 125,000 people each year. And it's all about not remembering to take it, or the side effects of the medication, or the cost of the medication, skipping doses, feeling like it's not necessary to be taking those. People who do take prescription medication, whether it's for a simple infection or a life-threatening condition, typically take only about half of the prescribed doses. This lack of adherence, and this is just in this country, is estimated to cause about 125,000 deaths and at least 10% of the hospitalizations, and cost the American healthcare system between $100 billion and $289 billion a year. Part of this is because of all the new drugs coming to the market, and I hadn't realized how much prescription medications are advertised on television until yesterday. I sat down for the first time since I'd been home, and before one of I think it was the Warriors game, and an hour before that, and almost every single program, I would say a minimum of 25 to 50% of the ads were for pharmaceuticals, drugs that were quite expensive, that the insurance companies are not paying for. The one that really gets me is the Opdivo, which is the one for Hodgkin's disease and late-stage cancer, and it says in the small print that this will give you from 3 weeks to 6 months worth of extra life, and probably cost $10,000 to $20,000, and for a few months more of living. And as we get into some of the depth of the drugs I'm going to talk about, you'll see where some of these drugs that are costing so much more money have not proved to lower your cardiovascular risk or your mortality rate, which is your death rate, even though it's costing you thousands and thousands of dollars. When doctors order these prescriptions, many times it's because the detail person has left them samples, and they're for serious kinds of disease states. Some of them are actually for transplants. Studies have shown that a third of the kidney transplant patients don't take their anti-rejection medicines. That's really critical when people are getting a transplant, that the rejection medications are taken so your body doesn't reject that new organ. 41% of heart attack patients don't take their blood pressure medications. Half of the children with asthma either don't use their inhalers or at all, or use them inconsistently. So when people don't take those medications, the hospitalizations increase, and of course the cost of health care increases. Non-adherence or not taking the prescription medication is a huge problem. There isn't any one solution because there are many different reasons why it happens. Many times for kids and asthma, it's the parent's decision not to prescribe or not to give medication that's prescribed. And it ends up in people like us who maybe take medication for a chronic condition, and we're old enough to realize that they do make a difference. And I guess as you get older and then they add more and more medication on and you don't feel any better, sometimes you feel worse. So rather than go back to the physician and say this isn't working, we just don't use it. When I was taking care of skilled nursing patients in the 4 nursing homes in Lake County a few years ago, and inhalers were prescribed, and the aides would give them or LVNs would give them their inhalers, and the dose would be 2 to 4 puffs every 4 to 6 hours if it was a non-steroid and just a rescue inhaler. Well, they're all on a schedule that these medications have to be given, and I'm not talking about anybody specifically, and haven't been taking care of those for over 15 years. But if you read the directions on an inhaler, it's for to empty all the air out of your lungs, shoot a spray into your mouth, hold it in there and hold your breath as long as you can, and then let it out, and then wait a few minutes and then do that again. Well, that takes an exceedingly large amount of time if you have a lot of elderly patients that are on bronchodilators or those kind of medications. And so we aren't consistent about doing that. Now, not only is that in a nursing home, but even at home when you tell somebody, and we have to refill those prescriptions many times earlier, and they're even metered now, which tells you how many inhales times that you can take the medication, and they will go 2 to 4 puffs, and they'll just take them all at one time. And the next thing you know, they'll tell their physician it's not working, and they will prescribe another inhaler. And 90% of the time, it's because they aren't used properly, and so you're taking an over amount of a steroid or a bronchodilator to open up your windpipes, the bronchioles that go down into your lungs, that it just isn't effective. And so then they add another drug, which is possibly a steroid, onto that. And then as people get older, my mother lived till 94 years old, and she would take her vitamins and she would take her Tylenol, but she wouldn't take her blood pressure medication or chemo. And other people resist medications because they view them as chemicals or unnatural. They'll take a over-the-counter product that is not as toxic as far as they feel, and not take something that's on a prescription because they feel like it's going to cause a side effect. So, and although the result of not taking those medications may not show up right away, it can result into serious long-term harm. And for example, statins, which are really cheap now, and there's a lot of data showing that's a huge payoff. But if people don't see their arteries as a serious problem and they don't think it's worth taking a drug, they won't stay on it. Or they hear other people about the side effects, and it drives down their decision to take it. So, and the cost barrier. When a drug is very expensive, like the biologicals used to treat rheumatoid arthritis, with these high expensive injectable drugs, and these are disease modifying drugs that actually keep the disease from progressing, they can cost as much as $4,000 a month for a copay, and they'll take less than the prescribed dosage, so they will last, and now they've got them dated to the fact that they're only good for 28 days or 30 days. So there's just many reasons that people don't adhere to taking those prescriptions. And our job now in pharmacy, and we are being penalized if you don't take your statin medications, if you don't take your blood pressure medications. It's called non-compliance. And the pharmacy is responsible for communicating with the patient and telling you that it's important that you take the medications. Another way you can do this to keep from taking as many pills is combine the drugs, and many blood pressure medications have the main ingredient in it, and then they have a diuretic with that also. And when you come to get a prescription, you ask us, or we tell you, what the possible side effects can be, and we don't tell you everything because we give you a document, a piece of paper that goes into detail what the side effects were. And those can be a little bit alarming if you're a patient and you read through those. It's kind of like going on the internet on a non-health site and then telling you what can happen to you if you take the medication or you don't take the medication, and what kind of side effects you can expect. And one of those is a statin. There are many people that are afraid to take a statin because it can cause some memory loss, and not thinking about if they aren't alive, the memory loss becomes more severe, so they don't think about it. And then there's up to 4 medication errors that are just huge that you are making as a patient. And I downloaded this before I left, and and the number one is, how common is instruction confusion? How much do you understand when we're telling you how to take this medication? How really to take it? Have you been confused by the instructions? And 65% of the people said they are. And even though the law requires us to give you instructions on how to take the medications, if we don't explain it in a way that is not confusing to you, then we ask you to give us a call. We'll go over it with you. And realize this: many patients take 5 to 12 medications a day, especially elderly that have different disease state. And here you are telling them how to take all these medications. You've been discharged from the hospital or just left a doctor's office, and our retention rate isn't the greatest as we age, and we probably don't remember 10% of what we were told, and that has to be a problem. Another problem is counterfeit drugs. That's a real and dangerous problem. The World Health Organization estimates that in developed countries, the incidence of counterfeit drugs is less than 1%, but 1% can still be a large number of medications. And Pfizer, which is a big drug company, found that Western Europeans spend more than $14 billion every year on illegally sourced drugs, many of them counterfeit. Most are purchased over the internet. They can occasionally make it their way into a hospital or community pharmacies. We have many guidelines that have to be followed in order to order from a wholesaler. A large number of people, patients, 54% reported they don't check if their medications are counterfeit, which can expose them to risk. Well, it isn't always to tell. Easy to tell that you have a counterfeit drug. They look the same. They have the same imprint on them, the same number on them. You already do everything to make sure that the medicines that we're dispensing are safe and effective. So we try to tell everybody that's getting them from other sources that there could be a problem with it being valid. But all you have to do is walk through the streets of Mexico and Central America and see the pharmacies that are selling drugs that you have no idea what they are. Just a serious problem. This next one that I just experienced this, and many times we don't think about it because most of the pills that we dispense are in a vial, but difficulty in opening the container package, difficulty in cutting a pill into smaller size, tablets or pills breaking when removed from the blister package, pills spilling out of the container, getting the containers mixed up and taking the wrong medications. The problem with medication packages is that I just got a Z-Pak, and there are 6 tablets. You take 2 the first day and 1 a day for the next 4 days. If I hadn't had a very sharp knife, I couldn't get the Z-Paks open. Now, maybe it's just me because I have some bad neuropathy in my hands, but I mean, you really had to go after this to get the antibiotic, and this is an antibiotic that you need to take. 24% of the people reported that a tablet or pill broke out or crumpled when removing it from the package. 23% reported that they spilled out of the container. More alarming, in their mail order or their internet, 8% reported getting containers mixed up and taking the wrong medication. So I guess as pharmacists we need to take the time to understand that people are having trouble with their drugs. If the packaging is confusing in any way, giving a brief lesson on at the counter. If you can change the type of packaging, making it easier for the patient, take the time to do that. And actually there are new label making techniques that highlight the labels and try to make the part of it that has the side effects and everything less confusing and less detailed than they were in the past, so you'll read it. So just another huge issue that's a big one out there and has to be taken into consideration when people are taking their medication, or they won't take it. And then the third one is, have you ever taken prescription medication that was not prescribed for you? And I find out that's happening more and more as the cost of drugs continue to go up. 31% of the people in this study had taken prescription drugs that were not prescribed for them. Some of this was drug abuse, seeking a new high. Most of it was, besides that, were antibiotics or what could we do as a pharmacist to stop that? When we find out a teenager who's found their parents' opiates, or the person who stops taking antibiotics early and gives the rest to a friend, you can control that to a large extent by education. We can let you know the dangers of an unattended person taking the prescription you're filling. My experience is it doesn't make any difference what we have told you. The people will do that anyway. And what's making it more confusing is today we keep getting new directions on taking antibiotics and taking medications, and for what we had always told you was a 10-day supply, and don't stop taking that until the 10 days is over, no matter how good you're feeling. Some of the guidelines have changed, and we've gone over those before several times, and they keep changing. And everything about the pharmacy business keeps changing as far as the kind of drugs we take, and what we tell you to take, and what we tell you is safe, and what we tell you may not be safe. You know, we've talked to you about non-steroidal anti-inflammatories that could be associated with an increase in high blood pressure, maybe 4 to 8 millimeters of mercury. Now we found out that just 4 or 5 days ago, the use of commonly non-steroidal anti-inflammatories seems to be associated with a small increase in the risk of having a heart attack. Although the overall risk with their use is raised by 20 to 50% compared with not using them, the risk for an individual is raised about 1% according to the study. And this was a pretty big study. This was analysis of 4 previous studies that included data from 447,000 participants, and of those, 61,000 had an acute myocardial infarction or heart attack. And what they found out was, and I'm just reporting this, I take a non-steroidal anti-inflammatory every day of my life because of my back problems, and it still doesn't take care of the pain, but without it, I could not even lift a pencil. Taking any dose of a non-steroidal anti-inflammatory for 1 week, 1 month, or more than a month was associated with an increased risk of a heart attack. High doses were associated with greater risks. The study found out the risk of a heart attack was greatest with higher doses in the first month of use, with daily doses of more than 1,200 milligrams of ibuprofen and more than 750 milligrams of naproxen. However, taking these for more than a month did not raise risks higher than those seen with shorter durations. The NSAIDs in the study included ibuprofen or Motrin, Celebrex, the naproxen, and it did not look at the effects of daily doses of low-dose aspirin, which could be just as disastrous. This is purely observational and shows an association between NSAIDs and increased risk of a myocardial infarction or a heart attack, but does not prove that there's a connection. And I'm telling you, this was the headlines on the nightly news 5 days ago, and telling you about the risk of taking non-steroidal anti-inflammatories, which later we will get into a part that says that's the drug of choice for chronic back problems anymore instead of acetaminophen or Tylenol. And you just kind of scratch your head and you say, what am I going to do? Well, it kind of gets down to the same thing that we get to the bottom of in almost every radio show when it comes to taking medications, and it's risk versus benefit. Am I not going to be able to go to work and pick up a pencil and write checks and do those kind of things, sit at a desk or stand and relieve my pharmacist if I don't take a non-steroidal anti-inflammatory? And at that point, what becomes the quality of life for me? And so I take the risk because the benefit is greater to me than not working at all or being able to function at all. And I think we all have to make those decisions. I think the world of social media has added to a lot of the discussion and a lot of the concerns about us taking medications. And yes, there are alternatives. There's acupuncture, there's surgery, there's physical therapy. There's a lot of things we're doing now instead of just cutting into somebody and saying, well, that'll take care of it, or as we've done in the last 15 years, give opiates. And you don't think I'd feel better if I took a Norco 3 times a day? Probably would, up to a point, and then it no longer would be worth it, and then you'd be addicted to the opiate. But life is not pain-free when you get to be our age, and if you think that it can be, and mask it with something that tells your brain you don't hurt, even though you hurt, or you take a non-steroidal anti-inflammatory which treats the reason that you're having the pain, and then you feel better because of it, but you risk having a heart attack because of it. So we're going to take a break, and when we come back, we're going to talk about people relying on fish oil to reduce cardiovascular risk. Does that really work? Have you recently been discharged from the hospital or special care facility and need help in getting around your house? Hi, my name is Bill Kearney, owner of North Lake Medical Pharmacies in Lakeport. My wife Dana and I own North Lake Medical Pharmacies, and in the last 7 years, we've been offering a new service in Lake County. Both of our pharmacies now sell and rent hospital and medical supplies. So if you need a walker, rollator, wheelchair, transport chair, we will rent them to you or sell them to you if you prefer. We also have lift chairs, hand, wrist, knee, leg, and back braces for your comfort if you need them. And if you're looking for a pharmacy that has great service, a $4.99 a month generic prescription plan, free delivery service to Lakeport, Upper Lake, Nice, Lucerne, and now Kelseyville, as well as rental and sales of medical supplies, then you need to come to North Lake Medical Pharmacies on Hill Road across from Sutter Lakeside Hospital and in front of the Bruno Shops Mart in Lakeport Boulevard.
Every day, 70,000 puppies or kittens are born in the U.S. Cute, right? Well, what's not cute is that half of all litters are accidents. And when a kitten has a litter of oopsies and a puppy has a litter of uh-ohs, pretty soon you have thousands and thousands of OMGs. And that leads to millions of pets being killed in shelters each year. But if 80% of people with pets say they believe in spaying and neutering, then what gives? Turns out that those sweet little fuzzballs can get pregnant sooner than you think. A lot sooner. But here's the good news. You can stop the accident before it happens. You just have to remember one number, 4, as in 4 months. When you bring home Maggie or Ruby or Puddles or Clyde, get them fixed at 4 months old. It can be old enough to get pregnant, and it's definitely young enough to make a difference. Prevent more. Fix at month 4. Visit fixat4.com for more information. Brought to you by Best Friends Animal Society.
Come join the 2-mile fun walk and 5K run at Westside Community Park in Lakeport on Sunday, May 28th at 8 a.m. The start is at the Westside Community Park and finish is at the Kiwanis Craft Fair at Natural High School on Main Street in Lakeport. Registration fee is $20 and includes a Westside Community Park t-shirt. 3 ways to register: on Saturday at the Park Committee booth at the Kiwanis Memorial Day Craft Fair, on the day of the walk starting at 7:30 a.m. and online at westsidecommunitypark.org.
Raising your family, tending to your animals, growing your own produce, preparing for the seasons, living the country life. Hi, I'm Jody Henke, host of Living the Country Life. Catch me every Monday through Friday at 9:35 a.m. and 4:35 p.m. for ideas and inspiration for your place in the country. That's Living the Country Life here on AM 1270 and 96.5 FM KXBX.
We bring the community closer together, supporting business in every way. We're helping make your dreams come true, working hard for you.
The Lake County Chamber of Commerce would like to recognize their Member of the Month, Polestar Computers. Polestar Computer Sales and Service was established in 1995 and has been serving Lake County reliably and professionally for 22 years. Polestar is the oldest and largest computer store in Lake County, providing exceptional customer service with competitive prices and dedicated to solving all your computer issues. Polestar Computers is located in downtown Kelseyville at 3930 Main Street. Call them at 1228 or visit polestarcomputers.com.
Lake County Chamber of Commerce, we're steady and strong, help us shape the future.
All right, we're back.
Okay, fish oil. Big item in healthcare. Debate will continue whether those supplements improve cardiovascular outcomes. This means with heart attacks and strokes. The American Heart Association continues to say it's reasonable for patients with cardiovascular disease to take about 1 gram a day of omega-3 fatty acids. And they also suggest patients with heart failure may benefit. I don't know. They might slightly decrease cardiovascular events in patients with previous heart attack and might modestly reduce death and hospitalizations in certain heart failure patients. But evidence for these fish oil supplements or fish oil is conflicting, and most of the newer trials show no benefit. The problem is with trials that are for non-prescription medicine. We don't have near the validity on those trials that we have on prescription medication. They don't add much benefit for cardiac patients that are already on statins and other meds. Plus, there's evidence that fish oil supplements do not prevent cardiovascular events in patients without heart disease. So there isn't any proof that using higher doses of fish oil to lower triglycerides. In fact, they haven't found anything that lowers the triglycerides very much that improves the cardiovascular outcomes. So at this point, the people in healthcare, standard of practice, tell patients not to rely on fish oil supplements to reduce cardiovascular risk. Instead, emphasize adherence to statins and blood pressure medication and quitting smoking. A heart-healthy diet, of course, is always better, which I didn't observe on the cruise. I was...
What heart-healthy diet?
If you're on a cruise, you have lobster every day.
I was going to say lobster and fillets every night, right?
And steak every night, and pasta every night, and of course dessert. And I'm not a dessert person, but I put on 6 pounds.
Oh, I'm sure.
I've lost it since I got back, but and I normally, all I do is eat breakfast normally. I don't eat lunch, and I eat a small dinner or supper. But there, if you don't go to a restaurant for a 7-course meal, you go to the smorgasbord.
Yeah, the buffet,
The buffet.
Right?
And
which I wouldn't be able to stay out of.
Anything from frog legs to anchovies to... I mean, one time it was a roast pig, an actual pig with the eyes. And,
yeah.
And then any kind of dessert that you want. And, of course, ice cream and sherbet. And, of course, you have to have wine with dinner.
Of course,
and anyway, if you are on a heart-healthy diet, which I would suggest not going on a cruise, could include at least 2 3.5-ounce servings per week of fatty fish, such as salmon or tuna. One day, after I got back, I did open a can of tuna and added crackers to it and a little bit of mayonnaise and ate the 2.5-ounce can of tuna. That was my one.
That was your...
Yeah.
Yeah.
Last night it was, because it was Mother's Day, it was a ribeye, a baked potato, salad, and a glass of wine. So, but if you do want to use a fish oil supplement, make sure it's one that's USP verified, contains the ingredients listed on the label, and doesn't have harmful level of contaminants. So advise checking labels for the amount of omega-3 fatty acids, and a product with at least 1,000 milligrams of fish oil may only add about 300 milligrams of omega-3s. So Krill oil supplements usually contain less EPA and DHA than fish oil and aren't proven to reduce cardiovascular risk either. So here we have things changing as we talk about them, as they continue to learn more and more about health care. The next item is oral antibiotics that should be avoided during pregnancy. Paul and I don't really have to worry about being
Not
pregnant,
at this point, yeah.
although sometimes we look as if we might be having a child. But a lot of people want to know what oral antibiotics are okay during pregnancy, and if it's not for your wife or your daughter or granddaughter, some should be avoided, and many have special precautions. The regular antibiotics like penicillins, cephalosporins like Keflex, clindamycin, Cleocin, that are generally safe, and those are used a lot for tooth dental problems. Penicillins, cephalosporins, and clindamycin are generally safe. Metronidazole, which is Flagyl, the labels discourage using it in pregnancy due to concerns about fetal abnormalities, the child being born with deformities of some kind. But usually short courses for vaginosis and trichomoniasis are okay. People haven't shown up with a lot of problems with pregnant women who have used short courses. Again, this goes back to our thing about risk versus benefit. You know, if there are other options, certainly I would use the other options. Quinolones like Floxin and Levaquin and Cipro and tetracycline should usually be avoided. Quinolones are linked to cartilage damage in young animals. Tetracyclines are used to giving tooth staining, turning your teeth black, and adverse bone effects in children exposed during pregnancy. But there's a drug called doxycycline that doesn't seem to be associated with those effects. So a short course may be okay when there aren't good alternatives. Again, they would be quite limited for the reason that you're taking it. Macrolides, which are things like nitrofurantoin and macrobid, or mixed bag. You know, I don't expect anybody to remember this, including myself. Septra or Bactrim is okay in the second trimester, but you need to just stay away from most of these. The physician is pretty well informed on, so I would stick with the penicillins, the cephalosporins, and the clindamycins. Those seem to not have a major problem with any stage of pregnancy. We talked about a drug several weeks ago that just came out called Repatha, and you'll see it. That's one of those drugs that's advertised on television, like Opdivo is, all the time, about patients with cardiovascular disease and trying to get your LDL, which your bad cholesterol, down by about 60%. Now, first of all, I don't know many people who need their LDL down in the 20s, but that drug is effective for taking them down to that level. But we've kind of been waiting to see if they improve the cardiovascular outcomes. And now evidence suggests that adding that drug to statin in patients with cardiovascular disease and diabetes prevents maybe one cardiovascular event for every 74 patients that are treated for about 2 years. First of all, you couldn't afford to take it for 2 years. In contrast, Zetia, which is a regular drug that you can add to a statin, lowers LDL by about 18% and prevents one cardiovascular event for every 50 over about 7 years. So these are the only non-statins with evidence of having improved cardiovascular outcomes when added to a statin, and they haven't been shown to reduce mortality or the death. Repatha costs about $14,000 a year, and it's an injectable, and Zetia costs about $3,000 a year. So I wouldn't be in any hurry unless you're just desperate to get your LDL reduced to rush to adding either one of those meds to a statin. Instead, combine lifestyle changes and taking that statin, which improves your star ratings, which are how you're rated by your insurance company when you are taking them. The Zetia for people who need a statin add-on, such as those with cardiovascular disease who can't tolerate a high-intensity statin. I mean, some of these now are recommending 80 milligrams of atorvastatin, which is Lipitor. Some people cannot take that because of muscle soreness, and so they have to add another drug. For now, if you have a very high LDL due to high cholesterol, or for patients at a high cardiovascular risk, it's really kind of marginal, and I don't prepare or pretend to be a physician on these things, but you're going to have insurance payers continue to require prior authorizations to limit the use, and this is called a specialty RX. It comes in a special category where the profit is very small for us to dispense it, and the result that you get from doing this is quite small too. And remember what I said in the beginning about how long it takes to have that cardiovascular risk. You're not going to be allowed to be on it that long. So explain the concerns about a very low LDL to your doctor, such as below 25 milligrams per deciliter. They aren't showing up in short-term studies because we've never had a drug that would take your LDL down to that level. So far, there doesn't seem to be a link with cataracts or adverse muscular effects like you have with the statin. So sometimes when I do this show, I think I just make it more confusing because of the data that's coming out. Because it confuses me, what's good and what's bad. The next drug I'm going to talk about, you see advertised on television all the time, and it's Vibersi, and it's for patients who have irritable bowel syndrome with diarrhea, and it is an opiate agonist that works primarily in the gut as usual doses to eliminate the diarrhea problem. Opiates may cause spasms of the sphincter, and this allows bile and pancreatic enzymes to back up and lead to pancreatitis. So if you don't have a gallbladder, you listen to this ad, and I just had read this article, and the ad came on. And they mention in the ad, for patients without a gallbladder, do not take this drug, but it doesn't make a big deal out of it. So pancreatitis symptoms may occur after just 1 or 2 doses, even with lower doses. So, and if you drink more than 3 alcoholic beverages a day, or you're going on a cruise, don't be taking this drug. There's also soluble fiber and loperamide, which is Imodium, that you can take for these kind of things, but they're trying to attract you now into taking these drugs for for comfort, and they're adding just one more complication to your load. The other drug that we need to talk about is these overactive bladder meds, and they're advertised all the time. If they're not selling you Depends, they're selling you the medication that goes with having bladder leaks. So many payers were used to requiring oxybutynin, which is a drug that was instant release before covering others because they tended to cost more. But now costs are coming down as these higher meds go generic, and there's a lot of alternatives to using these drugs, and put the efficacy of overactive bladder meds into perspective, because women on these meds may go from having 3 episodes per day to 1 or 2, and meds may reduce the trips to the bathroom from 11 a day to 9 or 10, which seems to be an alarming amount to me. If an overactive bladder is med is needed, we almost have to base them on coverage. And because these are a drug that affects the parasympathetic nervous system, because it slows down the central nervous system activity, and that's how they work, they are on the list for the Beers criteria, meaning the drugs that you could take and for this kind of condition. And because it can cause dryness of the mouth, it can cause dry eyes, it can cause constipation, they are a drug that's on the criteria for the star ratings for you not to be able to take, and for us to involve ourselves with the physician and try to get you off that medication. So not only is all the new medication causing a problem, it's the conflict of information that we're giving you. I had dinner with some people last night, and I was talking to the mother, and she told me that she went to see her physician, and her physician said, look, and something that I've said to you many times on the air, you're responsible for your health. I'm not responsible for your health. If you don't take care of yourself, it's your fault, not my fault. My job is if you don't take care of yourself, to get you out of the jam. And I'm not plagiarizing this. I'm just coming up with the message. And the message is, you're a responsible individual. Your life is dependent on how you treat your life, not me. It's my job, if there's something not functioning or working, and you've got a bad thyroid, or you've had problems with infections and those kind of things, to help take care of that. But your job is to take care of your health. You need to come to me when you haven't done that, and I will help you out. But your job is to take care of it. You have to be the responsible party. Nobody else is going to say, you have to do this. We want you to do this to make your life expectancy increase, but you have to be responsible also. And we keep telling you that. And we were talking about people making house calls. People don't do that anymore. Or if they do, very few do, as far as physicians or healthcare practitioners. That's your job, to get yourself into the doctor. So, and I know it's complicated when we don't have a lot of physicians around, but you need to pay attention to your health. One of the drugs that we're going to talk about is Tylenol, or acetaminophen. We were telling everybody in the past to take acetaminophen as the drug of choice for chronic low back pain, and we told you to take tricyclics like amitriptyline or Elavil, because that added to it. Well, we're going to tell you now that the evidence suggests that the tricyclics, the amitriptyline, aren't any better than a placebo for chronic low back pain, and there isn't any proof that acetaminophen works for acute or chronic back pain. I don't know. We continue to recommend non-drug strategies such as staying active and acupuncture, physical therapy, Tai Chi, yoga. They can help a positive attitude, which may boost the patient's benefit. If an analgesic is needed, here we go with the conflict. They suggest recommending an NSAID for most patients. The lowest effective dose for the shortest duration necessary. If the patient or you want Tylenol, it's okay to try. It's less risky than an NSAID in patients with cardiovascular disease, but very, very tough message compared to what we've learned in the past. Duloxetine, which is a non-steroidal anti-inflammatory, also an antidepressant with it, may work, but there isn't any evidence that it's really going to help chronic low back pain. So we can go back to the old opiate thing and see if that's works, but we know better that it really causes a problem with both the physician and the patient and the pharmacy when that gets to that. We're in a huge allergy problem now, and it's going to get worse. You'll see ads on television now for Xyzal, which is a 24-hour second-generation oral antihistamine. They're really pushing it on the networks and in magazines and on television. It's the fourth over-the-counter or prescription antihistamine to go over-the-counter after loratadine, which is Claritin, cetirizine, which is Zyrtec, and fexofenadine, which is Allegra. Clarinex will still remain prescription only for now. All of these things can be very confusing. Most of them are generic now. Levocetirizine is the active isomer of Zyrtec, and that's what this new drug Xyzal is made out of. It will be promoted and advertised as having a fast onset and a long duration of action. It's true that the onset of action may be an hour compared to maybe 2 or 3 hours for the others, but they all last 24 hours. So depending on how excited you are about getting it into your system quicker, an hour opposed to 2 hours, maybe be a reason to do it, but the Xyzal and the Zyrtec can also be more sedating compared to loratadine in a lot of patients. So when you see this advertisement that this new drug is out and it should be better than what's already out there, the chances are that it isn't any better or going to be any better. The last thing I have is a thing that's another confusing part, and that's about antibiotics prescribed prior to dental procedures for most patients. Questions are coming up when to use the antibiotics for dental procedures in patients with prosthetic joints. Experts have been moving away from recommending antibiotics to prevent endocarditis, which is an inflammation of the outer lining of the heart, due to evidence that they're usually not helpful. Antibiotics are typically safe for patients with prior evidence of heart disease or artificial valves. Now there's a move to limit antibiotic prophylaxis in patients who've had a joint replacement to help ensure judicious antibiotic use. What does that mean? That means because of all the tendencies for our bodies to have a resistance to an antibiotic being effective, maybe we don't need to use it. So the American Academy of Orthopedic Surgeons and the American Dental Association are now giving guidance to clarify those rare situations when it might be appropriate. Our job is to fill the prescriptions as we're giving them by dentists or orthopedic surgeons. They're trying to limit their risk of having a problem with having an infection once they do the procedures. If prophylaxis is appropriate, they suggest the usual regimen such as 2 grams of amoxicillin before procedures involving the gums or soft tissue. teeth cleaning, extractions, and dental surgeries and such. So I would never second outguess my dentist or my orthopedic surgeon when it comes to eliminating another source of a possible infection. And I can't say they're wrong by doing that. I think if they feel like it's necessary, I have great confidence in both of those classes of healthcare practitioners. I think they're the best ones to decide. I just lectured you about you being responsible for your health, but I think when it's the point that there's a risk involved, you have to trust your dentist and you have to trust your physicians that are involved in the surgical process. And if they suggest that they think it's a risk, although what they're trying to prevent is some bacteria getting loose and going into your heart and causing an infection in your heart. And what they're saying is that's quite rare anymore for the kind of conditions that we're talking about. So to be very careful about being on them for any length of time, and I think we've gotten to that point where they've shortened the amount of time they want you to take it. Sometimes it's just one dose. Whether that's enough to cause you to have a dependency problem or a problem with building up a resistance to that antibiotic, I think is a marginal thing. So I just want you to think about all the things that we've talked about today and how confusing many of those things can be. Give us a call at the pharmacies if you're confused about a lot of these things we talked about are things that you can do something about. A lot of the things we've talked about are things that us as a dispensing pharmacist need to be concerned about, such as proper use of inhalers and difficulty in opening packages. So I'm just so sorry today I couldn't be with you live. When I get back next week, I fly in on Tuesday night, and we'll be here next Wednesday morning. Want to remind you we're still giving immunizations, and Zostavax has been a big thing recently. There seems to be a lot of people more aware now of things that you need to get immunizations for. Medi-Cal has opened the door to preventive medicine much more than they had in the past. So remember that we don't need a prescription for most of these things. If your physician says you need the shot, or come to us and ask. So I'd like to remind you for the last time on a recording for a while, we're North Lake Medical Pharmacies with 2 locations for you. The 5136 Hill Road East across from Sutter Lakeside Hospital. Call us there at 263-6192. And outside the Bruno Shop Smart at 347 Lakeport Boulevard. Give us a call there at 263-1328. Thank you, Paul. Nice to be back.
Yeah, nice to have you back, Bill, and we'll see everybody back here again next Wednesday at 10 a.m. for Health Talk right here on AM 1270 and 96.5 FM KXBX Lakeport.